Bruno, as you know, we're producing a history archive for the Society, and interviews with pioneers like you will be a very important part of the archive. And I consider myself very privileged to have known you now for more than 30 years. Now, I'd like to start, please, with your very early experience when you were a medical student. So in 1967, when the first human heart transplant was carried out, you were still in medical school, is that correct?
Yes, I was still in medical school.
So what were the impressions of that to you at that time? Did it influence your subsequent career?
I must admit, no. I believe I not even thought about medicine. I wanted to be something more normal, like an airplane pilot or something like that.
So when was it that you first decided to go into medicine, and when was it that you first decided to go into surgery, and when was it that you first focused on heart surgery as a career?
It was very similar. In my time, you didn't have to be very talented to go to university. There was no numerus clausus, as we call it, and I was more like not an athlete who could perform in a particular specialty very well, but on average I was not bad. So I thought I could either become a school teacher or a doctor, and so I decided, of course, to become a doctor. A school teacher is, of course, not bad either.
So where did you do your medical school training?
I started it in Erlangen, which is close to Nuremberg, and then I switched. After my first exam, I switched to Munich.
And in Munich, when you were in medical school, were there certain surgeons, certain people that had a big influence on your life and made you decide to go into heart surgery?
Yeah, again, I didn't make up my mind very quickly and decisively. I wanted to become first a general practitioner, then a physician. I was very interested, so I did my doctor thesis in hematology. It was very cumbersome and frustrating, and when I did the round, I always asked what's coming next. There was nothing was coming, so everybody convinced me to become a surgeon, which was very difficult at that time. And good posts were very well sought after, and so finally I squeezed in the famous university surgical unit under Professor Zenker, he was like a duke, yeah. And you never asked him a question, you never spoke to him, and he asked you, and you answered him briefly, and this was the old ages in Germany, you know, and you had to make up your way up. And somebody, but I still wanted to become then, after a general practitioner, after a physician, internal doctor, after a general surgeon, you know. Somebody broke his leg while he was playing basketball in the evening, you know, which was completely not well understood, yeah, because as a resident, a surgical resident, you never played basketball in the evening. You stayed in the hospital, did some rounds or emergencies. I had to replace him. Actually, there was no need to replace him because he had nothing to do, you know. He was just a rotating general surgical resident in very famous cardiac surgery. Yeah? And they need somebody to push in the patients into the operating room and accept then the patient and bring him back to the ICU. And I remember very well during my first week over there, the anesthetist said to me, "You measure the blood pressure, you know, with the cuff, you know, that's difficult for you for the first week." And that was about the situation. Funnily enough, you know, I stayed in cardiac surgery. And my chief over there, and he supported me a lot, I must say, and he was very nice to me, was Professor Klenner. And he was and he is, luckily, still one of the German pioneers in cardiac surgery. he has done 600 repairs of tetralogies, and so he was actually very good.
Well, since that time, Bruno, you've become one of the most well-known and celebrated heart surgeons in Europe. And a large part of that, I think, was your interest in transplantation and the fact that you were a pioneer in heart transplantation. So what first got you interested in heart transplantation?
Yeah, as you mentioned, in '67, that was the first heart transplant, and Germany got interested as well. And actually, the cardiac surgeons in Munich got interested. And I believe they did their first 2 cases in '69. And one must say they were very dramatic cases, and the patients didn't last long as it used to be in the time, and they stopped it. And they thought they had much more to do beside cardiac surgery, do maybe 2 cases a year or something like that. And so they had a waiting list, one must admit, of about a year to do children and to do valves and so on. So I think it was, if I would look back, no, it was a sound decision to stop cardiac surgery. You know? And then came that Californian chap, you know, with the beard, Oyer, Philip Oyer.
Philip Oyer.
Yeah, Philip Oyer. And he gave a talk in Munich, and as it was, almost everybody had forgotten cardiac transplantation, and his results were very good. That must have been in '77, '78 at most. And I went to my chief, to Professor Glinner, and said, isn't that interesting? It was a great talk. And said, yes, he said, it might be time to do it again. And you could go away for 14 days and learn it in Stanford, you know. And so I found Philip Oyer. Funnily enough, I didn't see him very much at Stanford when I came. I must say that famous Holiday Inn, I don't know whether that's still there. And then I was introduced actually to you, and you taught me how to do it in 14 days, like Woody Allen, you know. And Shami, of course, was very supportive, and he let me just learn it in 2 weeks, which I found very interesting, and very nice of him, of course.
Yeah. Well, of course, not every. I think you underestimate yourself. Not everybody could have picked it up as quickly as you did, or have had the determination that you did to persist. And you went back, and it's still at a very early age. You did the first successful heart transplant in Munich, which was one of the first successful transplants in Europe. Can you tell us about your experiences of that and how it set up, and what was your first patient like?
After the first day, it must have been in '79, the 2 weeks. And then I went back and we did some experiments, and a year later I came, and we still hadn't done one, and there was 80. And so I stayed there, I think, another week or so. And then I went back, and then we did our first case. And in those times, it was, we belonged to Eurotransplant. Eurotransplant means Middle Europe. That means Germany. That's the biggest country, 80 million. And then Austria, Belgium, Netherlands, I think Luxembourg belongs to it as well. So, and in that part of the world, you could do kidney transplantation and even liver transplant. Pichemeyer started doing liver transplantation at that time from Hanover. But it was very difficult to start heart transplant. They just forgot you, you know. So they told us, well, they did nice kidneys, you know, and I asked, did you ask about hearts? I said, no, we forgot about that. Sorry about that, you know. Actually, we had a monopoly, yeah, and we were actually in a good position. Yeah. And then we had patients, and they died on the waiting list and so on. So it was difficult to start with. And then the German Heart Center, which is another, in Munich, which is another group, they did one in, I think in April or something like that. And we did our first in August in '81. And Novartis actually played a very strange role in that. They decided the German Heart Center, which is just a name, and this is just another group. It's not university. They should have the cyclosporin, but we should not have. We should do it with cortisone and azathioprine. And Professor Brendel, who was an experimental surgeon, in his institute, it was a quite famous institute. We did all the preclinical studies in dogs. He found Basel and said, you can't do that, you know, to give one unit in the city to cycle, the other one don't get it. Yeah. It was his achievement. So actually, the case was already on. You know, we prepared for scrubbing, and a little aeroplane with a single engine flew from Basel. I think in English it's Basel. That's in Switzerland. Yeah. Basel to Munich, which is I think 300 kilometers at most away from Munich. And it flew to our old airport and had in the bags a cyclosporin. You know, by the time it reached Munich and the hospital was just across the border, the other side of the airport. You know, we were finished with the case. You know, and so we could luckily give that. Yeah. And he lived for 26 years.
Well, that was quite an achievement. Of course, we're now talking 30 years ago, and cyclosporin was not available for general use, which is why you were having that difficulty. And 30 years ago, there was always a lot of public attention and press coverage and so on about transplants. Did you experience much of that with your first transplant?
No, we were very, I would say, very provincial in our thinking. You know, my chief, when he was involved in the 69 cases, in the 2 cases, and he had an awful lot of problems with journals. And Munich is not a small city, and there are a lot of journals over there, and all classes, you know. And and he said he would disappear. My chief said he would disappear. He doesn't want to deal with that. And I thought it's not interesting at all, because it was done in '69, 2 cases, you know, and then the German Heart Center did a case in April, you know, and that was heavily exploited, you know. And so I said, well, who cares about the second successful heart transplant in Germany? Just we kept on going, you know. So of course, I took care of the patient, you know. He was totally isolated, you know. He had to eat heated food, you know. It must have tasted ugly, you know. And water that was disinfected, you know. We were in gowns and masks, you know, as nurses, you know. In the morning, you know, there was a shower. I didn't shower. I showered in the hospital, and the nurse came out, showered as well, you know. It was some kind of...
Things were very different.
It was very different.
Very different management in those days.
Yeah, and we were worried about infection, of course. Yep. Yeah. And so just to answer your question, you know, so they found out that we had done the transplant after 2 days, you know, and then you know, journalists are always very negative. They thought we had made a mistake, you know, we wanted to hide something, and they were picking a lot on me, you know. I had stolen the heart, you know, and so on. It was a little bit unpleasant, but you know, as it is in life, you survive, and when you look after these times, you just laugh, you know.
Well, Bruno, tell me about the first heart-lung transplant, because that must have been the first heart-lung transplant in Europe, was it not?
No, it was not. I think the first heart-lung has done. Isn't that Terence done? Terence English?
Terence English. So
English,
what was the year you did your first heart-lung transplant?
Yeah, that was only 2 years later. Yeah.
So 1983.
Yeah, we did very well, actually. And we had, as I said, a monopoly. It was very nice, you know. had always a Learjet, and it was full of drinks, and champagne, and so it was pretty posh, and we flew everywhere to Hanover, to Berlin. We flew to West Berlin, and we crossed the Iron Curtain during the night. It was changed. Iron Curtain was actually, how you call it, in the railway you have these bars,
Yeah, barrier.
and they were closed, and you had to zigzag, so you don't, in a tank, you were afraid of tanks, you just crossed it, and we had to shut down all wireless radios and so on, and there was I think about 200. It was like in the movies, the spy who came out of the cold, There was the lights were on. It was at 3 o'clock in the morning, and there was a little hut, and we were in our little car with a heart on the floor, and they opened that up, and then came the man on duty came with his cap. He came very slowly and said, "What do you want?" And said, "Well, we want to drive to the East Berlin airport." It was German at that time. We were not allowed to fly to West Berlin. It was still in the hands of the Americans, the British, and the French. But a German pilot could fly to East Berlin. That was possible. So our Learjet was in East Berlin. And we said, we have a heart, and he thought we were crazy, he never heard of that. So he thought we would smuggle something, a bomb or something like. So he had to verify that he could leave us through, and he did that very slowly, and then he came back and said, we can go, So we crossed the Iron Curtain, and we were in West Berlin. We had an American captain who flew us to West Berlin with a propeller engine. It took us about two hours. So it was very romantic. But then people found out that you can do easily heart transplants. And so then Hanover started, and so on. A lot of
well, of course.
Then we lost our monopoly.
Yeah, times change. One very fascinating part of your life was when Barnard retired, and you left Munich to go to Cape Town to succeed him and be the chief of cardiac surgery in Cape Town. So tell us about what was the environment like in Cape Town at that time? How did it differ from Munich, and what were your initial experiences in South Africa?
My career was pretty much unplanned, so I just went into this and that, and I was lucky and so on, that I succeeded and survived in some way. And at that time in Germany, we only had, I think, 12 cardio-surgical units, and so the probability to become chief in one of these was very unlikely. And so Barnard, I don't know whether he was sick or uninterested, I don't know. We're talking about early '84, and he was not interested in his department for 4 years, and so they asked him to retire. I didn't know that. And he had actually very capable surgeons, 4, and he divided his department into 4 units, pediatric, adult, transplants, and the lab. And he did very well. He traveled a lot. He was very famous. He enjoyed that, And so while he was traveling, he came to Munich, And a good friend of mine said, "Well, it happens that I'm gonna have lunch at a nice restaurant today at midday. Would you like to join us?" I said, "Well, I would like to see Barnard. How is so?" I went there, and funnily enough, a journalist was there as well, a female journalist, Elke, my future wife, was there as well. He did actually the writing, and I didn't know her too close at that time, and then Barnard actually was very well behaved, which actually he could be other way around as well. You know, as I a little bit later had to know, and he was very polite, as South African can be. You know, and he said he decided to retire, and they're looking for a cardiac surgeon who can do that. And he visited our department the next day, and he visited transplant patients. You know, and the strange thing was, he said whether I would like to apply. I said, well, I would consider. And the strange thing was, he never did it actually. You could rely on it. He forgot about that. But he went back to Cape Town, and he said he actually met a guy. I don't think he remembered my name, and he said he met a guy, and he seemed to me quite good. I heard that from other people saying, so they were actually they testified that. And so I applied, and he was in fall. In '83 he was in Munich, and I applied in January in '84, and then they decided I should take on the post, and I started then in September. I didn't think a lot about South Africa. I was a little bit illiterate at that time. I was only interested in cardiac surgery. So I found out that there's something like apartheid over there, which was very strange to me. There was full apartheid, and apartheid was actually dismantled in the 5 years I lived there, and which was more or less some civil war. And in the hospital, they were all separated: female, male, blacks, and non-blacks, and all that very strange things, you know. And it helped a little bit dismantle apartheid, because I had them all the colors in one room, which they didn't like. So there were little protest letters, you know, to the Boers, and they told me they would show me the letters sometimes. But obviously, I was good enough to do the job, so they never complained a lot. And finally, apartheid fell to pieces anyhow, and the hospitals are like they were in cardiac surgery 4 years earlier, you know.
Must have been very strange for you to go from Europe to South Africa, because such a different culture at that time. And as you say, there was apartheid, and I remember visiting you at that time, and there was a bit of a scandal because you had chosen to completely ignore that in the hospital, and as you say, you had the blacks and the whites in the same rooms and so on, which up until then had never happened. Well, what about the concept of transplanting a black heart into a white person and vice versa? Did you come across that?
Yeah. Barnard was, I think he was, I don't know whether he knew that, he was the most successful heart transplanter in his time. He had very good results. He had good survival. Anybody else had drawbacks. And, well, Shamwe then managed within 10 years to have consistent success, of course. So for me, Shamwe anyhow is the top pioneer and the one who actually more or less made it possible. But Barnard was not bad with his, I don't know why, because he was not interested at all and somebody else did it. He had very good co-workers. But I found out that he did only 2 or 3 a year, maybe 4, and that's it. So he had not many, not plenty. Besides, he did heterotopic heart transplants, which the method is a little bit more complicated. And that had to do with South Africa, of course, because you had to take any donor, and the Boers were huge guys, you know, and you can't put in a 60-kilogram heart or a heart from a 60-kilogram person into a 120-kilogram huge guy, you know, so he did it heterotopically. Besides, we only had a propeller machine. We could only fly to Port Elizabeth at most to get the hearts, and so the hearts were half dead, you know, at that time. So they needed a little support from the recipient to struggle through and survive, you know. And I changed that. First of all, I was committed to do orthotopic heart transplant. And I had a monopoly again then, so I got the hearts from whole South Africa, and I had people who donated flights, not hearts, flights. So there were rich people who had Learjets, for instance. So we flew to Johannesburg, got a heart to Pretoria, we flew to Durban. Yeah. So in my best year, I did over 30 hearts. So we were flying long distance flights, and we had, as I said, we had the monopoly. And your question was, South Africa, 50 million people are living there, but most of them are black. Part of the apartheid was that the blacks didn't donate. So, I wanted to have the black heart. I thought I would be the king. I would do maybe 1,000 hearts a year or something like that. And there were plenty of criminal acts and people were dead. The mortality was about 30 to 40 people were dead over one weekend. You know, it's all unnatural deaths. You know. And then the dean said, okay, Bruno, they come to my office. You know, and the office were black persons in suits, yeah, like we have suits as well. But these were the chiefs of the tribes, you know. So they were not wearing outfits, as I saw, little feathers on the head or something like that. They were just like normal persons dressed, you know. And they explained me in a very solemn way that this is apartheid and all whites are bad and the blacks will not donate black hearts till apartheid is over. And then they will donate. So I had to fly, you know, to get the hearts. They were all white hearts. Yeah. No, but I transplanted blacks, put in white hearts into blacks. I did that. Yeah.
Well, that's very interesting. So just so I'm clear, you transplanted both black and white people, but the donors were all white.
The donors were always white because the blacks didn't donate.
Yeah, how interesting. Now, of course, that's changed now, I assume.
I hope so. I hope that it changed.
Well, now, around this time was the beginnings of the society. And you remember that the first meeting was in San Francisco in 1981. And that was the time when you were still in Munich. So please tell us about your recollections of the origins of the society. Who were the people involved? What were the early meetings that you attended?
I told you that the second time I was in Stanford, that must have been always in springtime, April or something like that. It was always very coolish, I remember. And you all said you would have a meeting at Hilton. Hilton at the time was very small. The towers were not there, and actually you could drive in a car. You could park in front of your room. And at a very small, and I was invited as well, at a very small back room, I think I would recollect 20, 30 people were there, and they were listening to talk. Shami was there, and the talks were more or less from Stanford. Stanford was on various subjects. Charlie Beaver was there, talked about his rabbits, you know, and my rabbit AEG, yeah, and I think Virginia, somebody from Hess was his name. He was a cardiologist. He was there, and that was it. I remember Stinson giving a talk.
Now that was the first meeting then in San Francisco.
Yeah, it was in 81, huh?
Spring of 1981.
Yeah.
And
29 years ago, if I'm correct.
29 years ago.
So 29 years ago.
Were 20 or 30 people at that meeting, yeah. and probably 100 times that now come to the meetings. And you were very influential in that because you were the 5th president, and for the first 8 years or so, the meetings were so small that they were tagged on to another meeting. You remember there was everybody felt that a meeting with 50, 100 people was not going to be self-sustaining. So 2 things happened. One was all the meetings were held in North America because that was felt that way you'd get the most people there. And the other thing that happened was that the meetings were tagged on to another national meeting. So either before or after the national meeting, the meeting would be held. Now, when you took over as president, that was the first year that the meetings were, number one, independent of another meeting. It was the first standalone meeting. So that was a milestone. And the other thing was, it was the first meeting outside North America and was held in Munich. So what were your feelings about that? Were you worried that nobody would show up? Were you worried about the attendance? Do you remember how many people came?
No, I wasn't worried at all. And I think the headquarters was in Chicago. Was it correct?
Headquarters were in Chicago.
In Chicago. They were very worried. Yeah. I thought nobody would come. And I said a lot of people would come. The Europeans would come. Heart transplantation was a very hot issue at that time. They were founding heart surgical units and transplant units everywhere in Europe, and so I thought it wouldn't be a problem. Yeah. And I think another handicap was that I was actually not in Munich. Yeah? So I was in Cape Town, and I had to do it. Handys were not invented yet, so a fax is not. I had to do it. I had a local committee, to do all that stuff, for me. But it was a very capable local committee. Professor Kemkes, I remember, and he was very good. It was a very good organizer, and he did that. And I think it was a great meeting. Another anecdote which comes into my mind, in those times, there was only one presentation at a time, and one must admit that the leading persons were all surgeons, and I remember very well when I was a couple of years I was in the council, and all the councillors were surgeons, and I remember a heavy decision whether one should take on non-surgeons. I think the first non-surgeon was actually Sharon Hunt. Yeah, I remember that. And of course, Billingham was there, but she was a pathologist, so she was a little bit in between, And those were the times, And so surgeons were actually doing the program, And I had to fly from Cape Town to Munich, and actually nobody was there, and nobody had read actually the abstracts. I was the only one, so. I must admit, I don't remember a lot about Munich. Munich was a nice meeting, and I think a very successful meeting, but the program was actually my program, if I may say so.
Yeah, no, that's very interesting. Until I would say you were president, and that's probably 10 years into the society, it was driven entirely by surgeons. And I think mainly because transplantation was driven entirely by surgeons up until that time. And things are very different now, of course. It's a much more inclusive meeting. What are your impressions now of the meetings that are held now, for instance, today, compared with the way it used to be 20 years ago?
Well, times change, and so I think the meetings are very good still. So this year, I think it's an outstanding meeting in an outstanding place in the world, in Chicago. And it's a little bit more cumbersome to follow. The topics you can listen to the topics several times, and there's not a single topic, and the little topics are more diverse, Today we both listened at donors from homeless people. I found it very interesting, and so we probably wouldn't have such a talk
right.
30 years or 29 years ago, or maybe 25 years ago, and so on, And so I think one shouldn't say things were better. Maybe they were a little bit easier, and they were more transparent. And now everything is more difficult. The donor shortage is more difficult. Everything is a little bit more difficult. I think that's the answer. But it's nice that the society is there, so lively, so people have an input. It's fun, and they, of course, say younger, much younger.
Well, we've talked a lot about the past, Bruno, and you're, of course, one of the major figures in bringing heart transplantation and also the society to where it is today. I'd like to end by asking you your vision for the future. I know that you're very interested in xenotransplantation, and of course we are limited to something like 3,500 donors, heart donors in the world every year, and that's been a plateau for many years now. And so the two ways to go, clearly, to increase the surgical treatment of heart failure are either mechanical devices or xenotransplants. And so I'd like you to give us your look into the future using your present and past experience.
As you know, we are both great admirers of Norman Shumway, and Norman Shumway had some sentences, you know, and he was not always right. I remember that he hated lung transplantation, and he said only heart lung transplantation is the true thing. So he was not quite right in that as well. So another thing is he didn't like xenotransplantation a lot, and his famous proverb is xenotransplantation is the future, and it always will be. I don't think so, but it is a very difficult achievement, and I don't think a single cardiac surgeon or a cardiologist can achieve it. Yeah? He needs various specialists, like virologists, he needs immunologists, he needs veterinary doctors, he needs people who can deal with the genome and so on. And, it's very difficult, and if you do that for a couple of years, then ultimately you will be successful. We do it now for 12 years, and we still have to battle for the ideal pig, and I hope the pigs will always be more ideal, but I think you can do it now if you wish. Yeah? It ought to be a little bit difficult because of legal and ethical problems, but double transgenic animals are available, very sound animals, gall knockout animals, CD46 overexpressing animals, and you could transplant them already, and you will have a certain success. Nobody knows how long it will beat the heart, but it will beat, and it could serve for sure as a safe bridge to transplantation right now. And what we need, of course, because we're living in 2010, is consistent results in preclinical trials in non-human primates, which is utmost difficult, very expensive and time-consuming. To do maybe a group of 6 or 7 or 8 animals that will last, well, a couple of years.
Well, you're one of the pioneers leading the way. So we've talked about the last 30 years. I want you to predict for me, finally, in 30 years from now, what will be the most commonly used heart replacement? Will it be heart transplantation with humans? Will it be xenotransplants? Or will it be mechanical artificial hearts?
I think it will build a human heart, and it would be my #1 guess. And I hope that people are more knowledgeable, and they will donate more. Yeah, they give their heart more freely. Xenotransplantation clearly will be there, and artificial hearts. At the moment, I'm afraid I don't want to be mean. At the moment, xenotransplantation works, artificial hearts will be out, because it's much safer, less thrombogenic. It might serve as a bridge to transplant, maybe, but as a long-lasting solution, I think you need a biologic solution. That's my opinion.
Yes. Well, Bruno, I'd like to thank you on behalf of the Society very much for your time, and I would also like to thank you for your wonderful contributions, both to heart transplantation, lung transplantation, and to the Society in the past. Thank you.
Well, thank you.